Watching Utah's #1 news station, this is 2 News at Noon.
Dr. Brett Parkinson, and you're from the Intermountain Medical Center Breast Care Center, right?
That is correct.
And we are talking about breast care preventative and all that because breast cancer preventative because it's Breast Cancer Awareness Month.
It is, all of October.
Okay, so tell us, when somebody is diagnosed with breast cancer, or when they just want to go and get an exam to see, you know, if they have any problems, what's the best place to go?
Well, what they should do is look for a comprehensive breast care center. And there are several criteria that they should consider when doing so. Number one, they want to know who's reading their mammograms. Do they have breast care specialists, radiologists who are specialized in breast care reading the mammograms? Also, does that breast care center offer all the modalities? Mammography, ultrasound, MRI. Is it truly comprehensive, meaning when the woman is diagnosed, will she be taken care of within the center? Will there be other specialists who will be looking after her and making sure that she gets the best care? Okay,
so these are things that we need to think about before we go and get a mammogram. Don't just select any place. You really need to do your research then.
You do need to do your research because you want a place that is high volume, because research has shown that the more procedures a place does, the better they will do them. You'll also want to make sure that the place you select follows national benchmarks. There are several national benchmarks that have been established that reputable breast care centers should follow. And at Intermountain, we fall within those parameters and we exceed most of them. Also, you want to make sure that the women will be able to be taken care of by a team of specialists, surgeon, radiation therapist, medical oncologist, geneticist. We offer all of those things. We also offer a weekly conference, so every new case is discussed by a panel of experts. And then the woman gets a report from that panel indicating which course of treatment she should follow. And if she wants, she can go to a clinic afterwards and meet with those specialists. So it is truly comprehensive. So we take care of her from the time of biopsy that the radiologist does in the breast care center until she is completely treated.
Yeah, and that's key because you don't want to be sent somewhere and tested and then you find out you have breast cancer and then you have to go somewhere else to get all your treatments, right? You can do everything in-house.
Right. The old paradigm of care was that a woman would get a mammogram at one facility, she'd be sent to a surgeon, several weeks later she'd have a biopsy. Well, now if she comes in with a palpable lump or she's called back from an abnormal mammogram, we'll do the biopsy the day she comes back. We'll assign her a surgeon, and we do a great job at doing that. I think the women of Utah are lucky that there is such good medical care in our state.
Great. Thank you so much for joining us today. I think that gave women, you know, a great look at their choices, and we will be right back after the break. Thanks so much.
Thank you.